Okay, next up we have Roger K. Roger K is a 73-year-old Hispanic widowed man. He's on a fixed income, lives in an assisted living facility following a minor stroke. Roger has partial paralysis on his right side, but is responding well to physical therapy. He presents as very friendly, outgoing, cooperative, but the staff and the other residents report he can be sullen, forgetful, and even belligerent at times. So there's a personality change there. Now, with somebody having a minor stroke, sometimes that happens. It could be part of his medical condition. That's something to investigate. It could also be that when he goes out, he's in a lot of pain. And of course, when we're in pain, our behavior changes and our personality changes a little bit. So that might be something to look into. Roger has a son and 2 daughters, several grandchildren who visit him weekly, which is awesome. They take him out on outings. Roger walks with a cane, and he leaves the facility on his own several times a week to go to church. Often it's after these outings when Roger's behavior changes appear. Okay, so that really indicates possible alcohol or drug use, right? Staff and other residents have reported the odor of alcohol on Roger, but he has not seemed intoxicated. Roger denies any substance abuse history, but does admit to enjoying a beer sometimes. Okay? He reports him and his late wife had an active social life, including dancing and drinking. He thinks about his wife often, and he misses her. So we could go with bereavement. A little bit more investigation would be good, really to look at persistent complex bereavement or just regular bereavement. Right now it just sounds like regular bereavement. It does sound like we want to investigate as far as alcohol. It sounds like there's probably an alcohol use disorder underlying this. But we don't have enough information to really make that call. Some of these behavior changes could also be due just to medical. So that's something to rule out. Those would be the first 3 to really go with. And then outside of that, a 4th one to kind of look at is maybe one of the depressive disorders. He could also be one that falls into an adjustment disorder, since his body has really changed and his ability has really changed. I don't know how long he's been in the assisted living and how long ago his minor stroke was. So that would depend on that as well. But those would be some areas to kind of investigate and to kind of look further in.